All we can ever really, control is ourselves. And so I think that that right now the place to start, in terms of taking care of yourself, is to first know that you can take breaks and end. You can even end the conversation when you need to, because sometimes I think people forget that they have that choice. That if things are really going in a bad way, they don't feel like they're safe, protected, or like somebody else is going to be hurt. There is always the option of saying, like, this really matters to me, but I need to end this conversation now. I need to leave. I need to take care of myself. These concerns are often about what the other person is going to be doing, but what is often under that concern is, what do I do in response? So what are they going to be doing? But now, how do I handle that situation? So if you can come in prepared for different things that might be going on and decide, okay, well, here's what I'm going to do, then you'll come in less anxious, first of all, and you'll be able to do it. So if you really do need to end the conversation, knowing that you can do it and when you're going to do it can make a big difference. And so coming up with a kind of a continuum of all the different ways your child might express concerns, because your child, some people are concerned that my child will bring something up that a complaint or criticism, and I won't know how to respond. And the concerns can vary in terms of, I don't know how to respond just because I don't know how to answer that, or I have some things I want to say that maybe I shouldn't say, all the way to they're expressing it in a way that I feel like I'm not taking good care of myself if I'm sitting here, right? And so coming up with kind of a continuum of what is the absolute best way they might say this thing to me, like if they have a concern, what is the absolute worst way, and then a few things in between so that you can figure out where you're going to draw a line. Like you can really start to plan out, if this happens, this is where I'm going to draw a line. You might find that some of the things that you're concerned about you can handle. So like, you're concerned that your daughter might kind of dictate the space. It might be about her needs. And that's like one level of concern that you might decide, well, maybe like for a time that can be okay. Like so it's about figuring out, what can I tolerate? Knowing that this is just one conversation. It might only be part of a conversation. To just think about the fact that, like, okay, planning ahead for where my boundary line is being crossed, knowing that I can make a choice about ending the conversation, even if it's just for 5 minutes. Even if I say, you know what, I need a 5-minute break. I need to, if you're in a therapist office, I need to go to the lobby and just sit. I need to take a little walk. And then when you do that, doing those 1-2 belly breaths, because we can do them during a conversation, but sometimes we need to get some space from that. That doing that can give you enough, maybe reduce some of the anxiety and arousal levels, enough to be able to come back in and either say, okay, I'm good to keep going, or, you know what, now that I've had a few minutes to think about this, I think that maybe we'd all be better off, or at least I know I'd be better off, if we take a break and come back to this tomorrow, or come back to this next week. Right? To know that sometimes the best choice is silence. To say, because sometimes I think we want to fix things, right? We want to fix things. We feel like talking more can fix things, when sometimes a break is more likely to fix things than talking more. To simply prevent yourself from doing the things you're going to regret and give them a chance to do things they're going to regret is better than like when you're both in a bad place trying to keep hammering it out. One thing to keep in mind is sometimes you can go to like a pendulum swing of you have almost no boundaries, and so in order to try to assert boundaries, you might go over here and assert very strong boundaries, maybe that are like, if you're picturing like a castle, you need to have some sort of wall, right, to protect yourself. Whether exactly what it's made of and where it is can vary, but sometimes if we're not confident in our ability to handle what's happening really up close to the castle, we need to set the boundaries further away from the castle. And that might be exactly what you need to do at that moment. But it might be that as you become more confident in your own ability to handle different things, the boundary doesn't have to stay there. So whatever boundary you put up now doesn't have to be the boundary you need in the future. And when you kind of approach it that way for yourself and for your child, if you are setting the boundary to say, you know what, right now, this is what I need because I feel like I have to take care of myself this way. Doesn't maybe have to be forever, it's just what I need right now. Everything goes in phases, right? All relationships. There's 2 steps forward, 1 step back. But once you give yourself permission to set boundaries and you know where you're going to set them, that can completely free yourself up to have a really good conversation within those boundaries. It's like kind of like if you didn't have any boundaries, any kind of wall, you wouldn't even be able to have the conversation, or it would be so hard to have the conversation because you're never sure, you're always worried what's going to happen next. Am I going to be able to handle this? Maybe I shouldn't even talk to them at all because I don't think I can handle it, right? So once you know, like, okay, I have a plan. I know what I can handle. I know when I'm going to draw a line. Within there is like all this freedom. It's like freedom within parameters. We were talking before about how boundaries can move. They don't have to be in the same place every time. For a really challenging conversation, if your goal is really to understand them, you might want to see, okay, how far can I stretch what I'm going to be able to tolerate, and recognize that might just be for this conversation. Maybe I'm going to tolerate a little bit more than normal for this conversation. You get to set whatever boundaries you want around situations like in my house or in a conversation with me. So knowing like what you can control and what you can't is essential. But you might set different boundaries for like, she's over for a visit, not tolerating this. We're here having a visit, right? As opposed to, you might have a different level of tolerance or different decisions you'll make with, I'm going to make this conversation all about, I want to understand you. And that's going to be my sole purpose. And then in that case, you might say, maybe I'm going to stretch the boundaries a little bit here because I'm trying to hear, right? Say what you need to say, because that's my goal. I just want to hear. But then you might say, okay, so here's another kind of way to set the boundaries. So I suggest that to the extent that you can feel comfortable tolerating a little bit and reflecting back and seeing what that does, because that might just de-escalate things immediately, right? Before it gets too high, just reflect back any kind of something that's borderline, not crossing the line, reflect that back. Whew, de-escalates the tension. But if it does get to the point where they're saying things that, you've decided you're not going to tolerate, a warning about that, but with care, with compassion. I really want to hear you. I cannot hear you when you're using that language. I just can't take it in. It's too triggering for me. It's too upsetting for me. I want to be able to hear you, but can you please do it without using that language, right? So that would be one way to kind of introduce it in a loving way that you do have boundaries, but you're doing it in a request way because you might want to start out that way. Like, I'm going to assume that you want, that I don't have to force you, that this is something you want to do. You just need to hear me ask, I want to let you know that this is affecting me, and I'm going to ask that you talk differently. But if it keeps going, that's when it escalates maybe to a demand where you say, okay, I'm going to have to end the conversation now because I just can't be spoken to. I can't hear this right now, or I can't hear this, or this is crossing a line of what I need to take care of myself. Letting them know, first of all, ahead of time, what you need from them if they start to cross the line. And then, depending how far they've gotten, and if you feel like you can engage, okay, this isn't something I can, take right now. And then at a point where you say, okay, now I'm going to have to end the conversation. But always doing it in a loving way to the extent possible. And that's much easier to do, or I should say a way that you're going to feel good about tomorrow. So you might not feel good about feeling like you're being too mushy if they've just treated you that way, but you also might feel good about punching back or doing something in a way that it feels like now you're back on the offense. But to be very clear, and this is so much easier to do when you know ahead of time, I get to do this. I have a plan. I'm going to do it. There's much less anxiety when you have a plan. So you have a plan to say, okay, I'm going to have to end the conversation now. I really do hope we can revisit this in a way that will work for both of us. Maybe just matter of fact is the way you need to do it. Right? So you need to, figure out what's right for you, because everyone has different personalities, different communication patterns with their child. But to really just think ahead of time, like, okay, I can't control them, but I can control me, and I want to feel good about this conversation when I'm done. I want to know I did my best to take good care of myself without harming my daughter and with our child, and well, as much as possible, leaving open the door for a future conversation where we can come back to it when we're in a better place.